Welcome to NCD Matters. I'm Saunthari Somasundaram. Joining us in our inaugural episode is the Minister of Health Malaysia, Datuk Seri Dr. Dzulkefly Ahmad. Datuk Seri is a long-standing champion of the whole of society approach to health, including partnerships between the public, civil society, and the private sector, the digitalization of health, and health for all. Datuk Seri, welcome. It's a pleasure to have this opportunity to talk to you today.
Thank you, Saunthari. Yeah.
So today we're talking a little bit about the lung health resolution. The lung health resolution is on the table of the World Health Assembly in a couple of weeks. Is one such an example of your approach. Proposed in 2024, the resolution calls for the global protection of lungs. Mirroring it, translating policy into action, is the Malaysian Lung Health Initiative. A model, if you will, of implementing the resolution. Both the resolution and the initiative encompasses and integrates all that you stand for. The addressing of just not NCDs, but infectious disease, an approach of global priorities with local implementation and united action. Datuk Seri, in my work with the NCD Alliance, we've often spoken of the missing middle, health priorities that fall between the urgent and the long term. Lung health is one of these. It's not a single disease. It's not always the headlines like pandemics. And because it crosses over NCDs and infectious disease, the risk of it slipping through the cracks is very, very apparent. So my first question to you today is, what brought you to this issue? And why is this the right time for Malaysia to lead globally?
Yeah, I concur with you. The fact that it is a missing middle in more ways than one. Urgent, important, acute, chronic, and as well, it immediately presents a dilemma and yet a unique opportunity, as it is in the kind of a cornerstone of sort. As a lung health, it spans over and across multiple areas. So in that sense, I see it as missing middle through the cracks. I like that word. If you see the flip side of it, it presents itself as a unique opportunity for us to, develop one novel approach, or making it to be, firstly, a cross-cutting intervention, and more importantly, not siloed. It is infectious disease come at the same time one that is also a non-communicable disease.
Right.
So it is chronic in that sense. So I think I summarize it as, and if I can take just a lung, we're not just looking at just lung cancer, but as well lung-related diseases, the COPDs, the emphysema, the asthma. Why now? You ask. Why global health? I mean, looking at it from a global health perspective, neglecting lung is surely not an option.
And as you mentioned as well, Datuk Seri, cross-cutting, and I think it's cross-cutting across all the countries, especially in the region.
Correct.
And Malaysia being, in the middle of this sort of region, being a middle class, middle income.
Upper middle income now.
But I think the lung resolution in that sense just doesn't look at the upper middle income, but it also looks at those of the lower income as well.
Correct. Yeah, it is both tuberculosis re-emergence and as well as lifestyle, a challenge of smoking.
Yes.
Which is environmental and occupational at the same time. So it really provides, as I said, a unique opportunity to address lung pathology or lung health.
Yes, and all those risk factors that you mentioned are endemic in this region.
Correct.
So I think in that sense, the lung resolution really resonates for the region as well, and just not for Malaysia.
Yeah, the fact that we are now also chairing ASEAN, and we want to escalate it even beyond ASEAN. It's the global, stage of WHA.
Yeah, and I think that's a wonderful resolution to bring forth in the global stage. A consistent frustration that I've seen, Datuk Seri, in international advocacy is the gap that we face between the declaration and the delivery. How does the lung health resolution fill this gap? How do you see it filling this gap between that advocacy and that delivery aspect of?
Right. It's always a lot easier to framing or writing a document or blueprint of sort. And we have had a lot of blueprint, white paper, whatever.
Yes.
But to really get into having a footprint where we get to execute, I think that's the challenge. So beyond just having a document, I think the important thing is for us to build a movement.
That's wonderful, yes.
Build a movement where you get to get the buy-in. And I think nation all over the world, apart from ASEAN and our regional peers, will be, there would be attraction to this. Immediately when you see we are coming with added value of converging both infectious disease and the pandemic of the NCDs. So I think it is so very important that the lung health resolution would have to provide a higher level framework for integrating lung health within national system and supranational in the sense of its outreach and how Europe in ASEAN and then later on at the global level.
But the nitty-gritty bit of it is actually quite holistic, isn't it, Datuk Seri?
True.
I mean, it spans across the whole continuum.
Exactly. And hence, nationally you would have to take a whole of government approach, a whole of society approach. And of course, it's also about, the continuum of care from primary, secondary, tertiary, from prevention, as to treatment. And as well, of course, at the end of the day, it's not just about patient care, but more importantly, it has got to be escalated into public health.
Right.
And that is human population or population health management of the population. And that is essentially public health. So you get to see not just patient care in hospital, but population care in terms of more on the preventative or the preventive aspect, where it has to be, within that facilities of our clinics.
Yes.
And that is primary care.
And I suppose the health literacy aspect of it also brings it right down to the community.
Exactly.
So it spans the whole.
Exactly. In that sense, it truly spans across the whole nation.
And for something like that, it's all about partnerships, isn't it?
Truly, as I said, it just got to take that modus operandi of getting, it's my usual frame of all hands on the deck.
Yep.
Federal, state, governmental, non-governmental, medical fraternities, the NGOs, the activists, the industries.
Yes.
And I think that's where we come to see a whole of nation approach.
And that's something you've always championed, Datuk Seri, that whole thing of having a remarkable coalition across all sectors. Do you feel that outside of this, can other issues have the same buy-in? Can this model be adopted in other issues?
I'm quite sure that it's no longer an issue of the health ministry, or for that matter, any ministry that could work in silos. I think the nature of the current challenges on health, or for that matter, any other life sciences issue, the more it is like, even when we're talking about planetary health, or the more on antimicrobial resistance for that matter. Those are all coming, has a health, a global challenge. It has all got to be, approach garnering or harnessing the resources of just not about the government of the day or the particular Ministry of Health, but it got to trespass and cut across, over the entire ministries, and not only that, public and private partnerships.
So you're talking about collaborations within nations, but it's
Correct.
also, for something like the lung health resolution to go across, it's also collaborations across governments.
Correct. That's where the supranational bodies like ASEAN,
Yes.
and of course we have WHA, and that is, the topmost supranational bodies that must address this. And I'm glad that already we are getting countries to,
The traction that you have, yes.
Yeah, so grateful that they are coming in quite early. And as soon as they understand that it's not just about the usual infectious disease kind of narrative, but rather one that merges both the pandemic of communicable diseases and the non-communicable diseases. I think that's where the traction has been slightly enhanced.
And I think the traction that you're getting as well is within the community, and I think it resonates very strongly with our partners, as you mentioned, in ASEAN and SEAR as well, Southeast Asia region.
Yeah, I'm really, truly, elated or delighted when I get to see China and Russia, among others, big nation coming to support us. So it's truly, very, very, very consoling.
I think it just shows the strength of the document. It's shared infrastructure, it's shared action.
I think the roadmap more or less, speaks for itself that you can't be left behind. Nobody would want to be left behind.
Exactly. And the way you've got it through is, it connects directly with communities. How did you think about having it in terms of, guided in this people-centric design of the lung health resolution and the lung health initiative? What made you go down that path?
Well, it's a continuum of care that is required. When you talk about having a collaboration that would just not speaking to any age group, or even for that matter, demographic differentiation of rural versus urban, because lung health, by definition of all those insult to the lung, particularly coming from smoking, the environment, and occupational kind of challenges, it truly trespass or cut across the entire nation, and therefore nobody should be left behind in this. I would really think that it's a shared kind of responsibility to really get to the UHC, leaving no one behind in that sense. So it is truly one that would not allow anyone to be left behind. So in that sense, it is a total nation approach.
And because you've made it patient-centric or person-centric.
It is patient-centric in as much a patient-centric as possible, but it has got its person-centric will not be handled to its completion or to its satisfaction unless you have the perspective of population.
Of course.
So that's where person-centric, there is a tendency for person-centric to be in a binary option of whether it's person-centric or population-centric. But here, when you talk about lung health, it has got to be handled almost like together and concurrently. So, yes, it is very much a person-centric approach, but at the end of the day, of course, when you talk about smoking, it is person-centric. When you talk about, but
it's still community-centric.
Exactly. An occupational setting is a grouping, much as also those that we are exposed to the environmental toxicant or whatever, they are, of course, population health, public health management.
Right.
So public health, a kind of approach. So yes, I would agree that much as it is patient-centric, patient-centered, it has also got to address the entire population management by way of public health.
And that's bringing public health into the community and public health listening
Correct.
to the needs and of the community.
True.
Datuk Seri, you mentioned environment, you mentioned occupation. When we speak about the commercial determinants of health, air pollution and occupational exposures can sometimes be overlooked. Yet, as you know, they're critical to lung health, and you've made them central to this initiative. Can you share how the Lung Health Initiative in Malaysia is tackling these environmental and occupational exposures?
Right. Yeah. When it comes to work environment or workplace,
Exactly.
and those settings, those really would require a partnership of organization, namely, if I may, Malaysian Industrial Safety and Health Association. So you get to address them and impress on them of the importance of lung health, because in the final analysis, it's all about getting employers and employees to be in this relationship of looking after one another. And employers would only get a workforce that are productive for as long as they are healthy. And lung is a main causative factor of absenteeism or even presenteeism. So which is only wise and pertinent that grouping like MISHA, the MISHA, and industry leaders, to be first made to understand that this lung health initiative, by way of both work environment and as well the kind of environmental and occupational challenges posed on their workers, I think all the more important that these are what is known as the commercial determinants of health in terms of air pollution, in terms of occupational exposures, which usually oftentimes overlook.
Yes, and I think what's so important about it is you're taking it out of the health arena and you're actually putting it into society, you're putting it into the environment and the workplace. And I think that's a very strong example of whole of society.
Correct, yeah.
In terms of the lung health resolution, Datuk Seri, you've made a global call to action. When you first promoted it, and that was in September last year, September 2024, it's actually escalated, and it's actually like a ball which is rolling down a hill because it's attracted so much attention and buy-in. It's a declaration, it's a resolution, but the work following declarations and high-level meetings is where it truly begins.
Right.
And setting up for success means moving budgets and systems. As we move the lung health resolution towards the World Health Assembly, what is your message to the international community? And what should they be doing to ensure that this becomes more than just words?
Right. I think this is so very important for government of the day to really understand that as I've always mentioned about health as a macro critical social, political, and moral imperative. So when we get to see how on the challenges of the pandemic of NCDs and infectious disease, lung presents itself, as I said, a unique example of how an organ of the body can be insulted in so many ways. And just not, as I said, about smoking, but more importantly, as we industrialize, the industrial pollutants, the intoxicant, the VOC, the volatile organic compounds, the phthalates, the, what have you, and as well, environmental. So it's so very important to impress on governments, wherever they are, ASEAN as well, takes to their, responsibility and own to this, take ownership of this responsibility to be part of this journey on lung health initiatives. And hence the reason why to understand, the offer by Malaysia in terms of our ministry that has worked so hard to get a roadmap, of what it takes from prevention right up to, the continuum of care from primary, secondary, tertiary, right up to, finally having an opportunity for lung to breathe
again.
Fresh air again.
I think that's just absolutely apt.
The government of the day must take to themselves to understand that the country and their citizenry is only as good as they are kept healthy.
Yes.
And that relates directly to the entire productivity of the workforce of the nation. So I think the government cannot identify with that. I think it's, as I said, is a macro critical imperative that government of the day must address. While, for example, our Madani government worked so hard to have a second economic takeoff of the nation to be again the roaring Asian tigers.
Yes.
But when the workforce is not, up to what
the health that they need to be.
So this would be the determinant, or rather, to me, the critical success factors, or rather, the failure in ascertaining and ensuring that the critical success factors of the nation productivity, the total productivity to be ascertained, to be determined, to be preserved. So that's where the failure is going to come from. So this Minister of Health is responsible to ensure that the workforce of the nation is really, beef to the
it is
teeth
at
to be
the best
healthy,
ability as it is.
So that's where I see my role in the bigger nation rebuilding.
Yes, thank you, Datuk Seri. And I think I hope that all health ministers are listening to this and believe the same and are as committed as you are.
I'm sure.
And this is it's a strong charge to Geneva. And as a reminder, at the end of the resolution is the beginning of implementation. Right. We can't recover lost breaths, but we can protect the next ones.
That's well said.
So thank you, Datuk Seri, for this conversation that we've had, for your leadership, just not in voice, but also in vision and in action. That was Datuk Seri Dr. Dzulkefly Ahmad, the Minister of Health of Malaysia, on NCD Matters. Until we see each other again on NCD Matters, thank you and goodbye.